Hello and welcome to our presentation on psoriasis. What is psoriasis? Psoriasis is typically a chronic autoimmune skin disorder which causes the skin to have a red and scaly appearance. It is a non-infectious skin disease and the exact cause of it is unknown. However, it is said to be due to genetic, immune and environmental factors which trigger or worsen the disease. It occurs as T cells mistakenly target and attack healthy skin cells, rather than unwanted bacteria, viruses, or foreign substances. Due to the intense T cell activity, the body creates a rapid increase in keratinocyte production, T cells, and white blood cells. Skin cells grow deep in the skin and slowly make their way to the top to replace dead ones. However, as the T cells cause such a rapid turnover of skin cells, the new cells rise up to the surface too fast. This causes an excessive amount of skin cells on the epidermis, which in turn appears as red and scaly. Other external factors play a role in triggering psoriasis in individuals, which either starts or can enhance it. These being from infections like strep throat, as well as any injuries due to the skin through cuts, bites, or sunburn. Stress, smoking, and other medicines such as beta blockers, iodides, and those containing lithium can also trigger psoriasis.
Typical features, common signs and symptoms. Typical features of psoriasis include sharply demarcated erythematous papillosquamous lesions and scaly skin which affects the extensive surfaces of the skin. These lesions commonly develop following trauma, which is known as the Cobner's phenomenon. This is also known as the isomorphic response. The Cobner's phenomenon is seen in a variety of other conditions such as warts, lynchonitis, juvenile rheumatoid arthritis, and lichen planus. If you are susceptible to this, it is recommended that you take care to avoid sunburn, contact with irritants, pressure dressings, and scratching. Another clinical feature of psoriasis is when plaque is removed, this may cause bleeding. This is known as Auspic's sign. Other clinical features or presentation patterns of psoriasis include plaque, flexural, guttate, localized forms, generalized pustula, erythroderma, and nail involvement. Plaques induce the pathologies such as trauma or UV light which cause an acute form of psoriasis, resulting in a much higher red coloration. Lesions that are typically chronic of psoriasis can have a darker red color, sometimes paired with a brownish hue. Symptoms include red or pink, small, scaly, inflamed bumps that merge into plaques of raised skin, causing the scaly look. This classically affects the skin over the elbows, knees, and scalp, and is often itchy at the most common sites of friction, scratching, or abrasion. Symptoms of plaque psoriasis include itchiness, pain, and sometimes bleeding in the affected areas. Furthermore, psoriatic arthritis is prevalent in 10 to 30% of victims of psoriasis. Therefore, joint pain and stiffness is considered to be another key symptoms for the condition. The main sign of inverse psoriasis is detection of red, shiny skin of areas appearing in skin folds such as armpits, under the breasts, and in the groin areas. The most severe form, namely pustular psoriasis, will show signs such as white pustules surrounded by red skin. Erythrodermic psoriasis, as this particular form has an appearance that presents like severe burns. Symptoms are quite serious, such as extreme body temperature change, and this may require hospitalization. Nail psoriasis presents with signs such as changing colour, formation of ridges or grooves in the nail, or a build-up of debris, which can cause the nail to lift away from the skin and can also be quite painful.
How psoriasis is diagnosed. Psoriasis can be difficult to diagnose as it closely resembles a lot of other dermatoses, infectious, inflammatory, and neoplastic conditions. People who have not yet been diagnosed with psoriasis may present to either a pharmacist or a general practitioner for original consultation. Psoriasis is usually diagnosed with the Psoriasis Epidemiology Screening Tool, also known as PEST, to establish the diagnosis and evaluate the severity of the disease. Characteristics that help to diagnose psoriasis include personal and family history, nail changes, distribution and scaling of the skin. From there, a full body examination is done, usually by a general practitioner or a dermatologist, to ensure that all types of psoriasis have been searched for and taken into account. However, in order to eliminate the possibility of other diseases, a biopsy is usually required, and cultures and secondary lab tests are conducted to confirm the presence or absence of psoriasis. Psoriatic arthritis usually affects interphalangeal joints, and therefore early diagnosis is important to prevent further joint damage.
In regards to the clinical course of psoriasis, comorbidity is a major component due to the increased chance of developing other health conditions such as a result of the formation of psoriasis. The most recognized comorbidity associated with psoriasis is psoriatic arthritis, which approximately 10 to 30% of psoriatic sufferers also develop this condition. In turn, this leads to an decreased ability to participate in physical activity, which results in further increased risk of developing cardiovascular disease. And this is supported by a study conducted in 2011, which found that people with severe psoriasis are 58% more likely to experience a major cardiac event and 43% more likely to suffer a stroke. Equally substantial as a physical health problem that arises due to psoriasis diagnoses are the mental health issues that follow. A survey administered in the United Kingdom found that individuals diagnosed with psoriasis, 79% were too embarrassed to go to the beach, 77% said their diagnosis provides them a lack of self-confidence, and 79% felt emotionally distress and anxiety. The same study suggests that it was estimated that 10,400 people that were diagnosed with depression in the United Kingdom that could be attributed to psoriasis per year. Furthermore, it was found in a survey by the National Psoriasis Foundation that 75% of patients believed that their psoriasis diagnosis had a moderate to large negative impact on their quality of life. When these physical and psychological factors are combined with the fact that there is no known cure for the disease, they immaculate to the belief that psoriasis has a low prognosis.
Treatment options. There are a variety of treatments available for psoriasis. Treatment options vary heavily depending on the severity of the condition. Patients with just a few small plaques affecting common areas like the knees or elbows often only require minimal treatment. In patients such as these, topical emollients such as white soft paraffin is sufficient in keeping the plaques at bay. The main aim of this treatment is to reduce inflammation and relieve the patient from itching. This is considered a short-term option as the body tends to adjust to this treatment over time. Therefore, they are recommended for mild to moderate cases. However, the problem does not lie in the lack of treatment. It resides in the patient's inability to adhere to the treatment. Psoriasis can spread and worsen at an extreme rate. For more severe cases, a more aggressive treatment should be used, such as light therapy. This involves brief, daily exposure to sunlight or artificial light sources, which decreases skin cell turnover, scaling, and inflammation. However, an excessive exposure to sunlight can worsen the symptoms and further damage the skin. Correspondingly, there is a possibility of short-term and long-term side effects, such as nausea, burning, and an increased risk of developing skin cancer. A psoriasis patient is considered to have a severe case if more than 15% of the body surface area is involved. However, certain types of psoriasis, such as erythrodermic psoriasis and generalized pustular psoriasis, can be severe and therefore almost vulnerable to topical treatment despite their body coverage. If a patient reaches this level of infection, systemic treatment options become the best and only efficient way to combat the spread. Methotrexate plays a role in antiproliferative activity as it blocks the formation of thymine and thus DNA. This plays an important role in reducing the proliferation of skin cells and therefore reducing the actual presence and growth of the plaques. It is a highly effective treatment for sufferers of severe psoriasis. The downfall, however, is it is considered to be quite toxic, producing hepatotoxicity in patients who remain on the drug for an extended period of time. Thank you for watching.